Hi students, today we will continue with the diseases caused by virus. Influenza. Influenza is otherwise called flu. It is an infection of the nose, throat and lungs which are part of the respiratory system. The causative organism of influenza or flu is influenza viruses. These viruses, it affects nose, throat and lungs. Okay. The symptoms are fever, chills, muscle aches, cough, congestion, runny nose, headaches and fatigue. Now, how it spread? This viruses spread from person to person through respiratory droplets. When an infected person coughs or sneezes near a susceptible person, susceptible means prone to get. Okay. So, near a susceptible person, an infected person cough or sneeze. This, through the droplets, these viruses are expelled out in the air. So this viruses, the susceptible person breathe in and then they get this influenza. Now what is the treatment for this? Rest and fluid intake. Plenty of fluid we should take so that our body will get strength to fight against this viruses or this infection. Next disease is AIDS. AIDS. All four alphabets are in capital letter. We read AIDS. The full form of AIDS is acquired immunodeficiency syndrome. From this word itself you understand which system this disease affects. It is a transmissible disease of the immune system. So this virus affects immune system, or AIDS is a disease which affects the immune system. Causative organism of AIDS is HIV. HIV is not a disease. It is a virus, that is human immunodeficiency virus. So causative organism is HIV. Now what are the symptoms of this disease? Fever, headache, muscle aches and joint pain, rash, sore throat and painful mouth sores. These are the symptoms of AIDS. Let's see how AIDS is spread from one person to another. It is spread through sexual contacts, sharing needles, syringes or other drug injection equipments. When you go to hospital, you have to be very careful. You should use the fresh needles or drug injection equipments. Anything which is using in the hospital, you have to see very carefully. You have to use, nobody's used syringes should be used, or it should not be shared. Okay. Spread through sexual contacts, sharing needles, syringes or other drug injection equipments. And not only that, through body fluids also it transmits. What are the body fluids you should know? Blood, semen, vaginal fluid, anal mucus and breast milk. That is why when you use, see, body fluid which is blood, through blood also it transmit. That is why when you do blood transfusion also, you have to check this AIDS whether it is positive or not. Somebody else's blood when we transmit to our body, or our blood when we transmit to other person, you have to do the test investigation you have to do and make sure that AIDS is negative, and then only you should take the blood or give the blood. Then breast milk, child is drinking milk from mother, through breast milk also it transmits, and semen, vaginal fluid and anal mucus also. And what is the treatment? No specific treatment so far discovered. Okay, no specific treatment has been discovered. Only symptomatic treatment. So you should know this disease is very dangerous, and once we get this disease, it's not going to cure. So you have to be very careful. So how it is spread from one person to another, when you know, then you should take care of that part so that you will not get this disease and you cannot transmit to other person also. Next disease is hepatitis. Hepatitis is an inflammation of the liver. The causative organism is, there are hepatitis A, B, C, D and E viruses. Okay. So these are the viruses, and symptoms are, viral hepatitis symptoms are similar no matter which type of hepatitis you have. If you have hepatitis A or B or C, symptoms are similar. What are the symptoms? Unusual tiredness and weakness, sudden nausea, vomiting and diarrhea, abdominal pain or discomfort, especially on the upper right side, beneath your lower ribs, which is over your liver. Clay or grey colored stool, your motion. If you have hepatitis, then your motion will be clay or grey colored. Then loss of appetite, low grade fever and dark urine. These are the symptoms of hepatitis. First, let's see how hepatitis A virus is transmitted from one person to another. First of all, it is a very contagious disease. Hepatitis A is very contagious disease. It is transmitted primarily by the fecal oral route. That is, when a person ingest means consume or intake or take in. Okay. So when a person ingests food or water that has been contaminated with the feces of an infected person, then we may get this hepatitis A. When an infected person prepares food with the dirty hands for the family members, we have to be very careful. It is a very contagious disease, and this disease is transmitted by the fecal oral route. How? When a person ingests food, take in food or consume food or water that has been contaminated with the feces of an infected person, then you are sure you will get the disease. Then a person, when you prepare food, you have to be very careful. Infected person prepare food with the dirty hands, then you are sure you will get this disease. Okay. Then not only that, fecal oral route, through sexual contact also this disease transmits. Let's see how hepatitis B is transmitted. Hepatitis B is transmitted from an infected person to a non-infected person through blood, semen or any other body fluid. You know, an infected person's blood, semen, or any other body fluid enters into a non-infected person, then you are sure that person will get the hepatitis B. Then this can happen through sexual contact also. Hepatitis B can be transmitted from an infected person to a non-infected person through sexual contact, sharing needles, syringes, or other drug injection equipment. Not only that, from an infected mother to a baby at birth. These are the ways hepatitis B transmits. Let's see how hepatitis C is transmitted. Hepatitis C is spread through contact with the blood from an infected person, sharing needles or other equipment used to prepare and inject drugs. Hepatitis D through blood or other body fluid enter from infected person to non-infected person. Hepatitis E is transmitted via fecal oral route and via contaminated water. What is the treatment for hepatitis? There is no treatment for hepatitis once it occurs. Only we can prevent by vaccination for hepatitis A and hepatitis B. There are no vaccines against hepatitis C, D and E. Remember, this disease also very dangerous. So you have to be very careful when you come across with such people, such patients in the hospital especially. So keep all these things in your mind when you come in contact with such patients. If you like my video, please like, share and subscribe. Press the bell icon to stay tuned.